Can IBS cause prostate problems? Now that may seem strange to ask, however, these two areas are actually very closely related. So what is the connection between IBS and prostatitis? The prostate and the colon are in direct contact with each other anatomically. So as you may be reluctant to recall, right, the doctor examines your prostate from within your rectum. And the prostate is not literally inside the rectum, but it's immediately next to the rectum, and therefore it can be felt through the wall of that area. This is why the doctor may perform a digital rectal exam of your prostate. Now, the extremely close proximity of these two organs means that inflammation in one area may impact the other area. And sometimes it's difficult to even tell, even by the doctor, which area is the primary culprit of your discomfort, of your pain and your problems. So there's a significant connection between these two areas, and that has been established well in scientific studies. IBS may lead actually to chronic prostatitis, and chronic prostatitis may mimic IBS, or it may even trigger IBS symptoms. And this can be particularly challenging, right? Because both areas require specialized care, and the doctor that you're seeing may be familiar with one, but not the other. So you may not get much relief sometimes when you're treating one condition and it's really the other, or it's both, right? And you may end up feeling like it's unresolved. Now, so it's possible to have both IBS and prostatitis at the same time, even if one isn't necessarily causing the other. So keep that in mind too, because that's something that your doctor may miss. Now, the symptoms of prostatitis primarily involve problems with urination, right? You might have burning when you urinate, you might have difficulty urinating, like say a slow stream. You might have frequent urination, often at night. You might have the urgent need to urinate. Maybe there's cloudy urine or blood in the urine. But the symptoms of prostatitis can also involve pain in the abdomen, and the rectum, which is very similar to many cases of IBS. So if you have any of these symptoms, obviously see your doctor. Now, can prostatitis cause constipation? Well, constipation can in fact affect your prostate because it's putting pressure right directly on that area. And chronic irritation to the prostate, like severe constipation, may contribute to an inflamed prostate, which is prostatitis. The reverse is also true. An enlarged prostate can cause constipation because it's taking up space in the rectum. And this is particularly true, say, for example, in prostate cancer that has progressed, may be impacting the rectum due to the close proximity, right, of these two areas. Now, another and more common connection between the prostate and the development of IBS is in prostate cancer that has been treated, right? Because treatment for prostate cancer can involve a variety of things. It might involve radiation, it might involve chemotherapy, or it might involve some kind of surgical procedure. Any of these treatments or procedures can and often do impact the rectum and the digestive tract, triggering inflammation and irritation that can lead to IBS. So at the IBS Treatment Center, we've seen actually many patients who are suffering from IBS post-cancer treatment. Now, this type of IBS requires special care and may not resolve until you've seen an IBS specialist. Do you have any symptoms that you suspect are related to your prostate or might be IBS?